Hello and welcome to Spokane County Spotlight. I'm County Commissioner Chris Jordan, representing District 1 in West Spokane. For today's program, I've invited 3 leaders who are working to address the opioid epidemic in Spokane County. We'll discuss the county's partnership with treatment providers to fight this epidemic and save lives. First, I'm thrilled to welcome back Justin Johnson, our Community Services Director at Spokane County. With years of experience in behavioral health, the county is lucky to have Justin guiding our response. My other guests are Ryan Kent and Bobby Smith. Ryan is the Executive Director at Spokane Treatment and Recovery Services, known as STARS. Bobby's a staff member at STARS who uses her personal experience in recovery to support others. Our viewers are well aware that the opioid epidemic has devastated communities, families, and lives across the nation. Today's guests apply their dedication and their skills to help those facing addiction and ultimately bring health and safety to the forefront here in Spokane County. Thank you all for being here to talk about solutions.
Thank you for having me.
Glad to have you guys. So Ryan, your first up. STARS is on the front lines every day, working with people facing really serious issues in their lives. Talk about the role you have as Executive Director at Spokane Treatment and Recovery Services and how that program makes a difference in our community.
Well, thank you, Commissioner, for having us on Spotlight. I'm glad to be on here and talk a little bit about what STARS has to offer and the services that we provide for the community. My role as Executive Director really is to get the word out about our programs and make sure that we're staying innovative in the way that we deliver service and keep an open mind to the needs of the community, as well as being flexible to those community needs, especially in a time like this with the opioid crisis and the fentanyl crisis as well. Mm-hmm. So that's the major part of my role. Many other parts, the day-to-day running of the agency, but focus is to stay on mission and provide the best possible services.
And can you give our viewers kind of a brief just overview of key services that STARS offers?
Yeah. First, we have our STAT program, also sometimes known as sobering, but STAT stands for sobering, triage, and transition. That is a outpatient service for individuals that can come in if they're acutely intoxicated and basically start the process of getting into treatment. We have withdrawal management, which is typically 3 to 5 days, also commonly referred to as detox. After that, individuals can move on to other treatment facilities. We do assessments in withdrawal management, and they can be assessed and move on to other levels of care at other facilities or stay with us and move on to a Karen's house or Cub house, which is a longer term treatment at between 30 to 90 days. During those programs, they work on things like housing, employment. Each case is individualized, so it's different for every person that comes in. And then after that program, they can move into our intensive outpatient. So, some individuals can come in and stay with us, in some cases, up to 2 years. So it's a really great opportunity for anybody that's looking into or is interested in not just quickly getting off of drugs, but if they want the whole gamut from start to finish, we have it.
Well, I'm glad you guys are helping people in our community, and our viewers will have a chance to learn more about that, so thank you. Mm-hmm. Bobby, let's talk to you next. Thanks for being here and sharing your story with the county commissioners when you came and visited us several months ago. And I believe, as I learned or saw when I came to visit the Cowley Clinic a little while ago, that you're a cook in the withdrawal management facility, and you're in training, I understand, with some peer support skills. So can you tell us a bit about your story and kind of the impact that STARS has had on you and that you're able to have on others through that experience?
Okay, as I spoke on before, I am a recovering addict alcoholic. I was dual diagnosed. I'm coming up on 18 years of recovery.
Wonderful.
I've always wanted to work in the field, but just was kind of scared, as I was telling Ryan yesterday. it was scary to me because I had somebody tell me the relapse rate for a counselor. So I let that hold me back. I am now a certified peer specialist
Congratulations.
and just waiting for some opening ups. But
Right.
STARS has really helped me on my journey as far as staying, because it's like any given time I could be right back there too. So I keep that in mind while I'm working, feeding these people the love
Yeah.
and the care that they need through the food, and being able to be open-minded and talk to them, not to judge them in any kind of way due to their downfalls. I share my experiences, how I've kept my sobriety, my clean time. I share all that with them. I'm very open about my recovery. I don't hold back on, telling them, and I just let them know, a lot of it is our surroundings, what we allow ourselves to be around, what we allow to come into our lives or stay in our lives. It's not an easy job being in recovery. It's not easy. There's no magic basket, as I've said many times. There's no perfect recovery. Some people fall, some people get back up.
Right.
It's a matter of the determination and knowing that you have people that will support you. In my case, I had my family. I have STARS. I have my coworkers. We have our bad days just like anybody else. It's like, well, it didn't go my way this day, so let's kick the cat or whatever, but you can't let those days get you down. I wake up every morning and I give my thanks to my Creator. I'm happy I got woke up. And I start my day like that. And I try to let other people know that, yes, we have bad days. We are
Well,
going to. It's just knowing what avenue to take in order to not relapse.
I think the folks at STARS are lucky to have someone with your insight and support for
I'm
their
lucky
journey.
to have them.
Yeah.
I'm lucky to have them.
Well, thanks for being there to help everybody out.
Thank you.
Justin Johnson, as I mentioned before, a friend of the show. Welcome back to County Spotlight. Remind our viewers about your job at the county and how that connects with what STARS is doing in drug treatment.
Of course, and thank you for having me back again to share a little about what we do and our partnerships in the community. So I get the pleasure of really overseeing, I think, one of the greatest departments in Spokane County, because we have some of the most public-facing work, engaging individuals generally in their most vulnerable time or with family members. Although we're not widely known, probably the best kept secret of the county, we engage quite extensively when individuals have behavioral health crisis, have a behavioral health need, or if there's a gap in the system. So my work really is focused in three key areas in our department under divisions. Behavioral health is one of the biggest ones, but we also provide two other ones. Under our counseling and recovery services, CARES, we do direct treatment services. A lot of individuals transitioning from inpatient treatment, Eastern State Hospital, we help connect them, as well as ensuring that they get stable housing on their road to recovery. As we know, the story doesn't end when individuals exit treatment. They need housing, they need the ability to be able to engage in the community and do so safely. Our CARES team does that. The other department that works with our community is our Developmental Disabilities and Intellectual Disability Division. And that provides community inclusion as well as employment support, economic and benefit to the county, as well as to the community to ensure that these individuals are included, as well as being independent and being able to work. But at the same time, we ensure that they have the ability to engage just as freely as anyone else. But the biggest one and the most well-known is our Spokane County Regional Behavioral Health Administrative Service Organization.
It's a mouthful.
It's definitely a mouthful.
That's government for you.
It is, but I guarantee you it's one that impacts the most amount of the community members. We are the backstop. When anything occurs for a crisis or involuntary treatment or the regional crisis line, we are the payers, the funders behind that, working with the state and managed care organizations. We're also the ones coming up with innovative new ways to ensure that service is provided better to the needs of the community.
Right.
And we're also ensuring that there's no drop in service or care. So how we partner with STARS, they are one of our providers that we contract throughout 6 counties,
Right.
Which includes Spokane County, but also Ferry, Lincoln, Stevens, and Pondere and Adams counties. And in that process, we work with them to bridge those gaps and ensure treatment services are provided in an effective, as well as necessary and responsive means so they get to where they're needed.
Well, your team does fantastic work. And let's back up a bit and talk about kind of what led to this partnership, and that's the opioid crisis. Last year, in 2024, according to the Spokane County Medical Examiner, 352 people in our county passed away from a drug overdose, with 76% of those deaths being fentanyl related in the past year. Pretty shocking number. And that number, 352, represents a 340% overdose death increase since 2019 in that 5-year stretch. And so fortunately, we've seen overdose deaths declining around the U.S. more recently. And the County Medical Examiner recently reported that for this year, we're starting to see our overdose deaths in Spokane County level off. So we are hoping and praying that we're turning the corner. So Ryan and Bobby, can you just speak to the impact that fentanyl and opioids have had in our region? What kind of changes have you seen over the past couple years?
Well, I've seen, fentanyl go from the bottom of kind of the use of drugs up to close to the top. I was looking at some statistics yesterday. Alcohol still remains the highest used substance at our facility, but the second highest is fentanyl, and that's 32% of all of our clients come in with fentanyl use. The thing that's difficult, I think, or challenging with users of fentanyl is they take longer to withdraw. Their withdrawals are more severe. It's a little bit more challenging to keep them engaged in services because of that.
Right.
Also, it's really important to keep them engaged, and one of the ways of doing that is if they express interest in medicated assisted treatment, we have that available, and I believe that is an important tool if the individual wants it. Fentanyl, however, can take, from what I've seen, longer for people to get onto MAT services or medicated assisted treatment because the withdrawals are so bad, and they get on medicated assisted treatment too early. It could cause precipitated withdrawal. And we're also seeing the hospitals through our hospital diversion program. They were already crowded. They continue to pack people in there with fentanyl use issues, and I could go on and on.
Yeah, it's a big challenge.
Yeah.
Bobby, do you want to add anything just on what you've seen?
All I've really noticed is that it's a younger generation getting affected by all of it as well. I talk to our people that come through, and I don't really ask them what their choice is, because to me that's kind of judgmental.
Yeah.
And to me it doesn't matter. You're here for help.
Right. Whatever
And
the
I'm
issue
here
is, you want to
to
help.
encourage you. So I can't really tell you if it's meth, fentanyl, whatever, but just by driving home at night or coming to work in the morning, I see what it's doing to our streets.
Yeah.
The people that are out there homeless, sleeping under the bridges, in doorwells, it's heartbreaking.
Yeah.
And to see the young people that are out there as well.
Right.
And it has a lot to do with that. And I don't know how they really know if they're doing fentanyl or meth, because I'm sure that it's being cut everywhere, into other products.
Yeah.
And so they think they're doing one, but they're actually doing the fentanyl.
Right. Well, big challenge, and let's talk about the hopeful side of things. A few years back, the Washington State Attorney General's office, under the leadership of our now governor, Bob Ferguson, pursued litigation to hold opioid manufacturers and distributors accountable for all of this harm that we've talked about. The state successfully obtained opioid settlement funds, some of which are distributed to local governments like Spokane County to fight back in this epidemic. As of this summer, the state's opioid initiatives had recovered nearly $1.29 billion for Washington State. So Justin, let's talk about the ways that your department has helped the county commissioners listen to the community, identify gaps, and work with partners like STARS to fill those gaps.
Yeah, of course. I think the first step there is just looking at the 2 decades worth of experience and a connection, collaboration that Spokane County has, either through the BHO, previously RSA, now the ASO, to engage in the community, really is where this led to how do we get that information, so we're targeting the key areas necessary to provide treatment in conjunction and alignment with what the settlement funds were designed for. And in that, we had 3 key areas, or at least this is what we advised at the direction of the board, 3 key areas that we believe to be the most pertinent. The first one was community feedback, all levels. Individuals impacted by opiates directly, family members themselves, and or those with lived experience. Community members impacted just from an ancillary sense through engaging in downtown businesses or going about their daily lives, to expertise, and those that are in the medical field and other systems, to ensure that we got all requisite information. The second area was collaborative engagements, ensuring that we were working with local municipalities as well as law enforcement and first responders. What are they seeing on the ground? What are they experiencing, and how can we best dovetail into that? And then the third area was funding. Can we make anything that we put in place sustainable? Being able to throw out one lump sum of money doesn't benefit anyone if we can't get a program that goes ongoing. So at the direction of the board, we hit those 3 key areas, opened up various opportunities for the community to give feedback online as well as in person. We hit local boards, and gathering all the information, we presented a package to the board, and then using the expertise said, here are key investments. Here's how we bridge the gap in areas that are not covered. Here's how we maximize the utilization of existing funds. And here is how we ensure these programs continue. One was an immediate program, meaning we need to address issues now. That was our STAT program. The second area was long-term investments. We know that substance use involvement as well as behavioral health doesn't just end after 72 hours. So we wanted to look 5 years in the future, invest the money now so we can address challenges in the future. And then we also wanted to be upstream and say prevention and looking at data. So those are the key areas that we provided to the board, and the board looked at those and chose I think the most pertinent ones that affected and benefit our community.
Well, we'll talk about one of those, the STAT program today, but it was great to have that community feedback, hundreds of comments from the public that kind of shaped our focus. So let's talk about STAT. We've heard about it. It's one of the core pieces of the county's immediate response, scaling up the STARS Sobering, Triage, and Transition program. So we are co-investing opioid settlement dollars with the city of Spokane to expand those critically needed services. The county's commitment at this stage is over $1.4 million, including capital and operating, more to come in the future. With the city of Spokane investing $400,000 to increase capacity, we can make a greater impact together. So I'm appreciative of Mayor Lisa Brown and Spokane City Council for that partnership. So Ryan, what is STAT? Walk us through how the program works.
STAT is an innovative program that, as Justin knows, is really close to my heart. I ran the previous sobering unit. This is a new upgraded version of that with some things added. So individuals that are acutely intoxicated, under the influence of alcohol or other substances can come into the STAT program. One of very few programs that will take individuals that are under the influence of drugs or alcohol and receive services that are geared specifically towards them at that stage. So an individual that's intoxicated may not be ready to start a service plan right away, but we provide a safe environment, start that process, make sure that they have access to an assessment if that is needed to move on to a higher level of care. The great thing about the STAT program is it is at our Cali location, which also houses our withdrawal management program. So the transition part of it is really easy. They walk right upstairs and they're in withdrawal management. So it makes it a lot easier for the individual to make that decision, which is a big leap for some, to go from being intoxicated to making the choice to receive services and go through.
You don't have to send them off somewhere else. You can say it's right upstairs.
Exactly.
So it's great to have that all in one place. Can you talk about how do people come to the facility, and what's the relationship like with law enforcement, if that's relevant to the situation?
Yeah. Pretty much any way you can think of, somebody can come to the STAP program. So we have family members call for loved ones that may be struggling. We have a doorbell that somebody can come up and ring and receive services. We have our Car 50 that we deploy out in the community in the region to pick up individuals that are intoxicated. They can flag the car down. We'll pick them up that way. We're on fire radio, so we get dispatched to any scene that there's suspected intoxication.
For the city, is that correct?
Correct.
Yep. In the city of Spokane.
Yep, in the city of Spokane.
And how about law enforcement referrals or drop-offs?
Yep. Usually Car 50 intercepts those types of calls.
Yep.
When they do not, they are able to, and have for a long time, they can drive right up and ring the doorbell just like anyone else, and we'll bring them in. We have a really good history with law enforcement throughout the region, just staying in communication with them. They know about our services and have been educated, so that way if they do have an individual that they happen to pick up that Car 50 didn't respond to, it's a quick process to get them into the STAP program.
That's great. So you've got the sobering triage, transition, withdrawal management in the same facility. What's kind of the next step for people?
Yeah, so once they are in withdrawal management, they start developing that individualized service plan, and I want to emphasize individual because at STARS it's very much a personal plan. Each person's going to be different in the way they need to approach treatment, and that's very important for success. But typically you're going to see somebody get that assessment and then be assessed at a particular level of care, and so that can range anywhere from your typical 30-day inpatient program to a longer term like our Karen's House or Cub House, or outpatient. So we refer out to our own programs as well as other programs throughout the community. Whatever's going to fit best for that individual is what we'll do. So they can move to a place that fits their service plan the best.
And you can transport people to certain
Correct.
places, which I assume is really important in that handoff, not to lose them.
It's extremely important. I think
great.
that's one of the biggest parts of the success rate is not having them drop off in between bed dates, basically.
Right. So Justin, from the county's perspective, can you talk about some of the data that you're seeing in terms of participation, indications of success?
Yeah, I mean, the deployment of the program happened pretty rapidly in the last year, and spinning up a new program takes time. And so from its inception, which really began in October of 2024, but really wasn't able to get things going for the renovation of the space and just getting the staff in, 1st of December, we've seen over 1,000 individuals receive a service. Probably more now at this point in time where we look at data.
But we've helped over 1,000 people, these folks have. Yeah.
Immediately receive treatment with no wrong door approach, which is a unique aspect, right? Really the only other avenue by which individuals could receive that is an emergency setting, but may not be appropriate for what they actually need. And it may not be conducive to their therapeutic engagement, right? And it certainly does put a challenge in our medical system. So providing this, the economic benefits, as well as the benefit therapeutically to individuals, is monumental. In those 1,000 individuals that we've seen, 80% of those have been referred into another level of care or even a higher level of care, either in the inpatient at STARS or to another provider. That includes same-day appointments for MAT treatment, for opioid use disorder, or other behavioral health conditions, and connections for long-term handoffs. So out of that, we've seen a 12 to 15% recidivism rate, which is absolutely amazing for programs for those that are coming back within a 30 to 60-day window, which for a lot of programs, it's about that connection, ensuring that there is a handoff, that they're not just sent on a bus to go to some time, and we reduce that overall wait time between an inpatient or an outpatient scheduled appointment, which could be up to 2 weeks.
I'm really glad to hear about some of the really promising results we're having so far. We're getting close to the end of our conversation, but Bobby, I just want to let you speak to what do you want our viewers to understand most about those going through recovery and what supports that are helpful for them?
Family, understanding that it is a mental illness because it takes us out of our normal element if we're active in our addictions. I was fortunate enough to have my children accept me back in and surround me. I made a pact that people that were still active and stuff would not come around me. I didn't allow them. I cut out some family members. It's a long journey. It's a
Right.
hard journey, and they need all the support that they can get, really, from wherever they can get it. Positive. You know, it's hard when you've already taken the trust from somebody. It's hard for those people to trust you again.
Right.
You know, I had a son that used to always panic anytime he saw me with a lighter. I'd be lighting the barbecue. Why you got a lighter? Things like that. So sometimes it takes a while for everybody to build back up because of all the damage that we've caused, you know. With the closing of that, I will say we do recover, and I'm living proof. I'm almost 18 years.
Well, I
So-
appreciate everything you guys do. Justin, congratulations to your team on winning an award of recognition from the National Association of Counties for this partnership. I know there's more to come from the county in terms of boosting our response. So I want to personally thank each of you for being here today, for the work that you do to support those in recovery. We're all better off for the work that you're doing. So thank you. We could talk about this complex topic for a lot longer. We're out of time. It has been a pleasure hearing stories about all the things that you're doing to save lives, talk about how we're working together for solutions. These are hard challenges, but there's a lot left to do, and talking with you all gives me hope. So thank you for being my guest today on the program. I'm County Commissioner Chris Jordan. Thanks for joining us today on Spokane County Spotlight.